Good morning, my professor. My name is Chidema Anyekwe. I am presenting to you this morning a community health promotion program, a case of El Paso County in Texas. El Paso County is in the westernmost county in the U.S. state of Texas. As of 2020, the census of El Paso is 865,657, making it the sixth most populous county in Texas. The county is surrounded by Douglas and Elbert counties in the north, Lincoln County in the east, the Pueblo and the Fremont Abdelette counties in the south and west respectively, and it was created in 1861 under the Colorado Territory. The main clinic in the county is the LaFay Care Center, which is free for low-income families who do not have insurance. Services they provide include women's health, social services, primary care, pharmacy services, STD screening, child welfare, and vaccinations. These free clinics are funded by grants and private donations. For the local public health services, the states have the primary constitutional responsibility and authority for the protection of the health, safety, and general welfare of the population. Much of this responsibility falls on the health departments. State report shows El Paso ranks among the highest counties in the state for school-aged vaccinations, with higher rates than the state average. According to the National Immunization Survey conducted by CDC to assess immunization coverage among young children in El Paso in 2020, 94.6% of children born in El Paso County received more than 3 doses of polio vaccine. This is higher than the national average of 92.7%. Hepatitis B at birth in El Paso was 90.2%, while the national average was 78.4%. You can see the wide margin. Other doses of hepatitis B in El Paso was 96%, while the national averaging is 91.1%. For the rotavirus series, 85.7% is the rate for El Paso, while 75.6% is the national average. For DPT among kindergartens, 98%, while national average is 96%. Other vaccines like hepatitis A, MMR, polio, and varicella were all 98%, while their national average was 96%. Department of Health provide low-cost vaccines to those children 0 to 18 years old who qualify, like Medicaid eligible, the uninsured, those enrolled in CHIP, or the underinsured. The cost of flu shot without insurance depends on age. It ranges between $20 to $75. Flu shot for the elderly is usually more expensive, depends on the type. Some may get free vaccines from the local health center and state department of health if they qualify. If a family do not have insurance, the children can be vaccinated under the Vaccine for Children, the VFC program. Disaster planning in El Paso. El Paso County's two biggest hazards are flood and wildfire. In planning for disaster, a neighborhood evacuation plan is developed. Local emergency management office is contacted to find out ahead of time what evacuation routes have been designated for each area. Map is distributed to community members to become familiar with major and alternative routes to leave the area before a disaster. For more information on disaster planning, visit readylpaso.org. I discovered in the course of this program that the four leading causes of death in El Paso are cardiovascular disease, stroke, cancer, and accidents. Hence, based on that, health messages I came across in El Paso were based on these popular causes of death. The first is no texting while driving. Almost every street of El Paso has that right up, no texting while driving. The next is smoking chaos. The next is say no to drugs. And finally, is the one I found most interesting, which says sitting is more dangerous than smoking. I don't want to tell you how much exercise I've done since I read this. I'm now scared of sitting for too long. For the community engagement I came across, one says our facility offers a range of services to suit each person's need. Click here to get a brochure today. This is a call to action by community health clinics encouraging people to inquire more to find out what services they provide and which ones they need. I believe this is effective because the number of people that turn out on that clinic is very high. Moreover, all their services are being patronized. Another community engagement I came across was the one on COVID, which said COVID-19 is real. Wear your mask to be safe. I also believe this is very effective because every majority of the people I came across in El Paso, including little kids, all had their mask on. You can see this sign in most offices or most establishments. It says stop, face mask required. By way of reflection, a recent Wale Hub survey shows El Paso has the third highest uninsured rate among the nation's biggest cities. The county has continued to witness increased enrollment. Healthy community starts by creating a safe environment for its citizens. Collaboration is the key. And in the words of the health supervisor I met in the clinic, he said, while protecting human rights is our primary objective, we also act in concert with many other agencies, programs, and organizations whose work help to protect and enhance environmental quality. Thank you for listening.